Hello, everyone. I'm Paul Kegabine with the Garland County Library in Hot Springs, and we're here again with our Garland County Health Officer, Dr. Jean Shelby, who's going to discuss the latest in the COVID-19 pandemic in our area. And any questions you have for him live, as always, please don't hesitate to post them, and we'll read them off shortly after Dr. Shelby starts us with a progress report. Today's March 11th, and almost exactly a year since the first case of coronavirus was confirmed here in Arkansas. And I know we're all tired, but it seems like there's a light at the end of the tunnel. So maybe Dr. Shelby will have some positive news for us tonight. All right, Dr. Shelby, I'll let you get started and join in for questions later.
Okay, thank you, Paul. Thank you for having these series of talks to kind of get everybody on the same page and up to date. About the pandemic and where we are in Garland County specifically. I'd like to kind of look at a few things looking back, because this is kind of the 1-year anniversary of the beginning of the pandemic here in Garland County, and it's also the 1-year anniversary of the formation of our Garland County COVID task force, which I think has been a really wonderful thing, and for our community. We've gotten many people that really come together to do all we can to deal with and move forward from the pandemic. As Paul said, I'm the Garland County Health Officer. That's how I became involved in it. The Garland County Health Officer, it's a voluntary position where I'm recommended by the county judge and approved by the Arkansas Department of Health, and work as a liaison with the local health unit as well as the state health department. But as we get things started off, again, we are really pleased with our community's response. This task force was really organized by Chief Davis with the fire department, and Ty Ferris is the director of training, as well as Bo Robertson, the Department of Emergency Management, and Judge Mahoney, our county judge. We have been meeting every Monday morning at 9 o'clock. The first meeting, I think, was actually in person. All the rest have been Zoom. We've met every week, regardless of holidays or weather events, and I think it's been a really good exercise in communications to kind of help our community respond to this. And I'd like to take just a second to kind of recognize some of the people that have been instrumental and involved in this. Certainly Susan Lester, who is in charge of our local health unit here in Garland County, has done an excellent job in bringing information, but also head up the testing that we've done, as well as bringing us information from the health department. Certainly the County Judge Mahoney has been very instrumental in many of our activities, as well as City Manager Bill Burrows has been very much involved. Also, I'd like to really recognize Janice Ivers. She is head of the nursing program at National Park College, and really stepped forward to set up our local call center, which has been, I think, an excellent thing early on in the pandemic, but continuing on as different questions have come up, to have a local call center rather than people trying to call Little Rock or a national call center. I think it's been a really important aspect of our dealing with the pandemic. Also, we've had good participation with Chief Chapman of the Hot Springs PD, as well as Under Sheriff Lawrence from the Garland County Sheriff's Office. They've always stepped forward as we've needed things or getting information out. Aaron Street is head of the public information at the Sentinel Record, at the city, and has been very instrumental in us getting the information out from our task force and to the community about keeping things up to date. Also, we've had Jason Gardner with LifeNet has been involved, as well as Steve Erickson with Visit Hot Springs, and Gary Chapman with the Hot Springs Chamber. We've also had good input from the representatives of CHI and National Park Medical Center, and certainly at certain times that's been so crucial at all the things that both of our hospitals have done to kind of take care of patients, but also do things to really help us respond to the pandemic. As the year went on, we added people to the task force. We had very good input from National Park College, as well as all 7 of the school districts in Garland County have been very active participants in our task group since we were able to get back into school, and which I think has been one of our great things to be proud of in Garland County, that how well our school systems have dealt with the challenges of the pandemics. We've also had representatives of our local nursing homes, and they were truly on the front lines, and really we all owe a debt of gratitude for the hard work that they did. As mentioned before, when we have our weekly meetings, I update the group on our previous week numbers and where I feel like we're going. And it's really been very positive over the past 2 to 3 weeks that we've really seen our numbers of new cases and active cases really come down remarkably well. And I'll kind of run through a few of those now, kind of based on, I do it on a weekly basis, and so I can compare week to week, and I have been doing that really since March and April of last year. And for the week that ended this past Sunday, we were down to only 92 new cases, which is the lowest it's been since early October. And our testing is down a little bit, but with our lower case, we were able to drop our positivity rate down to 5%. And just a month ago, we were running like 14% when our active cases and new cases really skyrocketed. And we've seen a really good decline in our active cases. This past week, we were down to 145 active cases, and in mid-January, we were up. I was afraid we were going to approach 1,000 active cases. We were up around 900. So to come from 900 down to 145 is very, very remarkable, and it happened because of good cooperation from everyone and good hard work from many people working on this pandemic. This week, I think we're continuing that trend where we're still seeing some new cases, but our active cases is continuing to decline. We are up to 240 deaths in Garland County as of today. Certainly our number of deaths have gone down substantially from January, when we were seeing double-digit deaths every week. It's hard to track sometimes the deaths because sometimes it takes a while to get that information into the database, so it's not really very current. But again, I think we're seeing a decline of that. And at our last meeting on Monday, we got good reports from both hospitals that their number of COVID cases in both of the hospitals was in single digits, which it had been in probably at least eight or 9 months, and so I think going forward, as far as new deaths, I think we're not going to see very many of those as long as if things keep going forward as they are. One thing that I emphasized at our meeting is the importance of continuing to be vigilant and safe in our interaction with other people. We still do have active virus in our community, and so we need to continue with the masking and social distancing, and just being aware of your surroundings and aware that you still are at risk of getting this potentially deadly disease. So we need to continue with that. And also, one of the things that's very important, for a while, there was a really strong interest in testing, and people, especially early on when we had very limited testing, it was hard for people to get tested. That people that wanted tested and wanted to be tested and needed to be tested, but we really expanded our capability of testing. We still have the testing available at our Garland County Health Unit, as well as at many of the clinics around the county provide testings. I think some of the pharmacies do, and in order for us to really wipe this virus out of Garland County, we're going to need to continue to be tested, and anyone that has any kind of symptoms that could potentially be COVID related, I really strongly urge them to be tested, and or anyone that thinks that they might have been exposed to COVID. We're also encouraging testing, because the earlier we can identify someone that is positive, whether they have symptoms or not, the quicker we can isolate and prevent further spread. One of the things that I am encouraged about is that with the lower numbers, I feel like we're going to be able and are able to do a better job of the contact tracing. When we were having hundreds of new cases every week, it was just not we were not able to keep up with our contact tracing. The contact tracers would not be able to contact the person who was infected for 4 or 5 days, and sometimes had a hard time contacting them. So the efficacy of contact tracing really goes down when you're not able to do it rapidly and completely. So again, I would encourage us, if not to think that this virus is gone. It's still here. We're getting it under control, but in order to wipe it out, we really need to continue doing the things we're doing. Of course, we're very excited about the vaccine. Still an amazing kind of medical miracle that we were able to develop and manufacture and test vaccinations against this terrible virus in such a rapid manner. But it's amazing what modern medicine and science can do when there's a really strong need and motivation to do it. And currently we have 3 vaccines. They've all been proven to be very safe and very effective. And fortunately, we're getting more vaccine into the county, and we're getting more people vaccinated. And that seems to be really ramping up on a weekly basis, and it's something very exciting. And but it's something that we've still got a ways to go until we get everyone vaccinated, or as many people as we can. But we are definitely going in the right direction. I don't really have any specific numbers about vaccinations in Garland County. People get their vaccinations in counties other than where they live. And so I don't think there's really any real good data on that. But as a state, as of today, 21% of the people 16 and over have had at least one shot. And then we've got 12% that are fully vaccinated. And we see that as something that's really is accelerating. One thing that we discussed at our meeting on Monday is that we're getting more vaccine into the county, and we're kind of slowing down as the number of people that want to be vaccinated who are eligible to be vaccinated. And so we had quite a discussion on things that we can do to make sure that vaccine that is coming into our community gets injected in people so that they can be protected from the virus. And fortunately, we've got some clinics that are being set up, as well as individual the hospitals are still doing some vaccinations, and private clinics are, and certainly the pharmacies. That's been one of the focus of where we've got vaccinations, and we're continuing to do. The pharmacies are really, kind of doing the key part of the vaccinations. And of course, the national companies like CVS and Walgreens and Walmart are also participating in some national federally vaccination programs. So there's lots of ways and lots of places to get vaccinated. And one of the things that was kind of fortuitous, that Monday morning after our meeting, and the governor announced the opening of another large group of people to be vaccinated, and he, by expanding what had been just a portion of the 1B group of people, he expanded to all the groups in 1B category to be eligible for the vaccination. I think you can see on the screen the different groups that are included in 1B, and you can look down, and it's a wide variety of people, but there is also it's not really that specific. But the health department came out with a kind of clarifying those different categories yesterday, and we'll probably talk about it, and if people have questions, they've really kind of identified in more detail what those categories entail. And we've got it up here, maybe too small for people to see, but as you can see, it does go into really specifics of people that are now eligible to be vaccinated. Again, I think we'll probably go over that some more. As far as people that are interested and want to get vaccinated, the City of Hot Springs website has a lot of up-to-date information on how and where to get your vaccination. I would encourage you to check that, as well as check the individual pharmacies that are offering the vaccine. And like I say, there are a number of them that are doing it now. Also, we've had, I think, 2 mass vaccination events at the fairgrounds that have gone very, very well, and we're planning on having another one this upcoming Tuesday. And as of today, they're expecting to have 1,500 doses of vaccine available for that clinic, and so far they've had not near that number of people sign up. And one way that people can sign up, if they're eligible in either the classification of 1A or 1B, is at the convention center on Monday morning from 8 to 12. People can sign up to be able to get their vaccine on Tuesday at the fairgrounds. So that's one specific way of people that are interested in getting the vaccine and are eligible to get vaccine can do so. Again, one of the things that we've seen, even in the groups in 1A, some people were reluctant to get the vaccine, were concerned about the way it was developed, and concerned about possible side effects. And what we've seen in certain groups, as people see people that they know that have gotten the vaccine and have not had any difficulties with it, are now stepping forward and wanting to get the vaccine, because it's going to be real important for us to get us really a significant percentage of our population vaccinated in order to really eliminate this virus from our community. And I certainly reassure people that even though this vaccine was created very rapidly, it still went through a really severe market test for number one, to make sure that it was safe, and then also that it's effective, the clinical trials show that, and we're definitely seeing that in the distribution of the vaccine now. I think in Arkansas, and also the study of the effect of the vaccine doesn't end with the initial clinical trials. There's an ongoing study of the vaccine in terms of safety, but also efficacy, and that's an ongoing thing. And now that we've seen millions of doses of the vaccine given, any kind of severe adverse reactions is extremely rare. I don't know that we've had any really severe adverse reactions in Arkansas, and we're nearing 1 million doses. We've definitely have 1 million doses available, and I think we've probably got 600,000 or 700,000 that have already been given with very, very few significant side effects. So that's just kind of an overview of where we are in terms of what's going on here in Garland County, where we are in the vaccination program, and going forward. So I think now I'll open it up to questions and things that we want to look at more specifically.
All right, thank you, Dr. Shelby. We are getting some questions in. If you still have any, please comment those there in the stream. Let's see. At what point will the pandemic no longer officially be designated a pandemic? That's my first question. Can you hear me okay?
You're breaking up. I'm not really hearing. I didn't hear the question.
I said, at what point would the pandemic no longer officially be designated a pandemic?
Oh, I don't know the specific numbers. I think that we'll see the downward trend. I think probably one of the things that you kind of do with a virus or a pandemic like this, and what we're really doing with the vaccination is reducing the severity of disease. I think once it gets to the point where people aren't in the hospital with it, people aren't dying from it, that it'll become more of the virus may still be here, but it's not something that is going to really cause really a lot of significant problems. So I think that'll be more the end point. And that's one of the reasons that early vaccinations went to the most vulnerable people, especially like the nursing homes. That's where the older population, those were the people that were getting the severe illness and dying from it. And so as we get those, as well as other groups that were susceptible to severe disease, if we get them where they're not getting infected or not having disease, then the virus may be around, but it's not going to be that big a deal.
Toma in the comments says your hard work over the past year is appreciated, and her question is, Alaska just opened vaccines to anyone over 16. Is there any thought about when we in Arkansas can look forward to opening eligibility?
Well, it'll be a slow, gradual process, and like I say, we've made progress. We've made progress this week by opening it completely to everyone in 1B, and I think the goal is to have everyone in 1B that wants the vaccine to have it by the end of March, and then we'll move on into 1C, which is a much larger group of people, and have it available for them. As far as the people, right now, the vaccines are mainly for people 18 and over. I believe, and I have to check on this for sure. I think the Pfizer vaccine can be given to 16 and 17-year-olds. I know they're either Pfizer or Moderna, and because they've done the studies that show that there have been no side effects, and there are ongoing studies by the other vaccines for this group, but also for I think there's some of the studies going on down to 12 and up, and once some of those studies have been completed, we'll expand it into that group.
Thank you. And just a reminder for anyone watching, we have the document for 1B breaking down all of the people and jobs that are eligible right now under 1B. So if you have any questions about those specific industries or careers, we have that document available if you'd like to ask for clarification. I received an email.
I'll mention one thing to you, Paul. Library workers are included in 1B.
Yeah. Oh, we know. I have a story to share that was emailed to me by a man named Stephen, and he has a question at the end of it. He says, "Dear Dr. Shelby, my name is Stephen. I'm 58 and live in Garland County. I am in group 1C for heart disease. I had open heart surgery last October for a quadruple bypass. I have huge scars that are still healing, and I am going to cardiac rehab at CHI in Hot Springs. I am on the COVID vaccination waiting list at both hospitals. Every doctor I've seen for the last 6 months has told me to get a COVID vaccination ASAP, but I can't because the governor moved high-risk patients down the list. I called the Department of Health's COVID hotline today, and they told me my best bet was to go to Texas to get a vaccination. He wants to know, is there any way a heart surgery patient of his age can get vaccinated in Garland County, or should he go to Texas?"
I don't know. You know, there's no. I don't know of any official way of getting vaccinated at this point. I think that there will be before the beginning of February. We'll see how many people in 1B that are eligible actually get the vaccine. It may it's potential. You know, this vaccination clinic that we're having on Tuesday. I don't know at this point. It's not set up for if we don't have enough people in 1B to sign up for it to allow other people such as this gentleman to have it officially. You know, we're kind of bound by the directives from the governor and the health department as far as officially giving vaccines to people that have been designated as higher priorities. So I really don't have a specific answer on that. And you might just kind of call around and see if somebody has some extra doses that they could potentially use, but I don't know anything specifically.
And just to clarify, you said by the beginning of February. I think you misspoke there. What month was that? You said it'd be available for 1C by the beginning of February. Did you mean a different month?
Well, I mean, we hope to move into 1C the beginning of April.
April. Thank you. Question from Becky. What are some of the side effects of the vaccine?
Well, the side effects can be, probably the most common side effect is some soreness at the injection site. Other people do have some body aches. Some people actually run fever and have some fatigue. In the Pfizer and the Moderna, with them being requiring 2 vaccinations, the side effects tend to be more common in the second side effect, in the second dose. But I mean, I think a lot of people really don't have any side effects at all.
With the number of vaccinated people increasing, there's increasing pressure for states to remove their mask mandates and other restrictions. Is it wise to remove those restrictions too early?
Yeah, I don't think we should remove it too early, and I think I mean, there's certainly ongoing, research as to when we will safely be able to do that. So I certainly encourage people to continue to wear masks. The CDC did come out with some guidance just last week that that people that have been fully vaccinated, which means with the Pfizer and Moderna, had both vaccines, and then 2 weeks after their second vaccine, that's when they're considered fully vaccinated. And the Johnson and Johnson, with it being a one shot dose, it's 2 weeks after they receive that, they're considered fully vaccinated. And if you have a group of people indoors that are all fully vaccinated, masks are no longer required. But as far as kind of in a kind of general sense of things, the main thing that is being studied and hasn't really been determined yet is we know that people that have been vaccinated can still contract the virus, but it's a mild or asymptomatic infection. The big question is to whether they can also transmit it, and that has not been determined yet. It's being studied, and hopefully what it will show is that the people that are being infected after vaccination have such a low viral load that they don't have enough virus to transmit the virus, and so if that's determined, that would be the point where it would be a lot safer especially for vaccinated people, not necessarily require all the precautions.
Are there any other guidelines for what people can and cannot do safely once they get vaccinated?
I'm sorry, I didn't hear what you said.
Sorry, are there any other guidelines for what people can and cannot do safely once they've been vaccinated?
That's the main one that I'm aware of from the CDC, as far as relaxing some of the requirements on vaccinated people. They may be coming up to some, but that's the main one that I'm aware of.
Are you aware of any guidelines when it comes to traveling?
No, that hadn't really been determined. I know that's certainly being looked at closely in terms of, especially I think probably international travel, which has really been curtailed greatly as to whether airlines will either require people to be vaccinated or make it easier for them to decide to let people travel if they've been vaccinated. But perhaps in some countries that has been determined. I don't think that has in the U.S. yet, but I know it's been looked at closely.
Question from Paige: how do we get on a waiting list for the vaccine?
Well, right now it really depends. I think some of the pharmacies have waiting lists. I'm sure they do. And then the big one clinic that we're having on Tuesday, at this point, the only way to sign up for it, and there may be some other ways eventually, but now is to go to the convention center between 8 and 12 on Monday, and you can sign up to be vaccinated. But again, if you're in any of these groups, I think it would you could call the pharmacies that are participating in the programs, and they have different ways of signing up, and this would be an excellent time to do that because right now we're seeing more vaccine, and we're having people come forward to wanting it.
Scott says he appreciates your efforts as the health officer of Garland County and wants to know, what are the chances we will reach herd immunity?
I think it's probably pretty good, but it's kind of a difficult thing to really evaluate at this point because one of the things that we really don't know is how long someone that has been infected, how long their antibodies are going to be protective. It may be 3 months, it may be 6 months, it could be a year. And also, even the vaccines, since they're such new vaccines, we don't know how long that they will provide immunity. And then you've got the question or the variant strains that are developing. Um, you know, the one from Britain is more contagious, and the concerns about the South African variant is not sure whether the current vaccines are going to be as effective against it as they are against the main variant or the main strain that we've had now. So it's something it's going to be that'll determine, in many ways whether we have herd immunity. Is how well the vaccine, as well as the natural bodies building of immunity. I think that what I've heard, it's in the range of 60 or 70% of the people either been vaccinated or have recovered from an infection.
Speaking of the new variants, are there any confirmed cases in our area?
I don't know of any in our area. I know Dr. Romero mentioned that they have identified one case in Arkansas. I think of the British variant, and I think one of the problems to identify with those, they have to do sequencing of the actual virus that someone has, and the health department does have some guidelines on when and what group of people that do test positive should have their tests sent to the health department. I don't think the health department in Little Rock has the capability to do the sequencing to actually identify the variants. They have to send it to the CDC for that testing. So, but I think it's assumed that we do have the variants in Arkansas. And probably in Garland County, we just haven't had the testing enough to really kind of say for certain and how much.
Is there any update on the efficacy of the vaccines on these variants?
Um, I think there's been some, and that at least the English variant seems to be you have full protection with the current vaccine. They're looking at I think in all the vaccines, they're working on either developing a kind of a little bit different vaccine that would come around as a booster to it if necessary. So it's all kind of new stuff that's being studied, and I don't think any definitive conclusions have been made.
And how about the expectation of if we'll have to get a vaccine annually or seasonally?
Again, we don't know how long the immunity from the vaccine will last. And the people, there are lots of people studying it all over the world to see, and I think we'll have some good answers in the future on that. But we don't have that information yet.
I saw a report from CNN today where it was in a different country, but they had tested positive for 2 different variants at the same time. Did you see that report, or do you have any comments on that?
No, I haven't seen that report. I assume that would be possible. Though usually in an infection, if you do have multiple mutations that one of them becomes dominant, in an individual person, and also one variant will become dominant in the general population. But that was pretty sophisticated testing, and in order to get enough of that data to make conclusions, it just takes some time.
Do you know the latest on the single dose Johnson and Johnson? What the timeline will be for that to get to the public?
From the discussion we had at our meeting on Monday, we felt like that there is some of the vaccine in the state, and that there would be some coming into Garland County soon, within the next week or two. I think the strategy at this point is in terms of using it, they're really going to go after the populations that may be more at risk to not being able to get the second dose. People that either in rural areas, or people that maybe like homeless people that have a difficult living circumstance, and making planning to come in and get the second dose, or have hard time for people to communicate with them. It's time to get their second dose. So I think we'll be seeing some here very soon, but it's probably not going to be widely distributed real soon.
Do you have any feedback on the plan for how we will distribute this to our homeless population?
I don't know anything. I don't know of anything specifically that we're doing. I know that people are certainly looking at it, and it may not come to fruition in the next 2 or 3 weeks until we really see how much the vaccine we're going to get, and kind of this probably deciding how best to go about setting that up. That's a difficult population to really be to work with, because of the transient and the nature of their lifestyle. But I know it's being looked at pretty seriously.
Are there any other groups or populations that that there's a struggle to get the vaccine out to?
Well, there's certainly been concerns about minority populations, that people that don't have access to the healthcare system as much as a lot of people do. I know that Dr. Delahaye was asked that question about the minority population recently, and her response was that we're probably not vaccinating the minority groups as much as we should, but we're not that far behind what's happening around the country. But it's something that's on the mind of the people at the health department, and looking and partnering with groups to see that everyone has access to the vaccine, and also encouraging everyone to get the vaccine.
So in many other countries, especially some in Asia, wearing a mask was in many cities and parts of public transport already kind of a public norm before the pandemic. Do you think this can or should become the norm here in the U.S.?
Well, I think that we'll see people wearing masks. I think for a long time. I think that in certain circumstances, masks will become common. I just kind of speak, for me personally, since I've been wearing a mask for the last 12 months, I haven't had any kind of allergy problems. I usually get a couple upper respiratory infections every year. I hadn't had anything like that. So I really think that for me personally, I'll be wearing a mask. I know that I'll be wearing a mask if I get on an airplane, or if I go to a place where there are a lot of people around that I don't know. And I mean, I think one good example of the efficacy of masks is that we basically didn't have a flu season this year, and they're seeing that in a lot of places, and really given the fact that people are wearing masks and doing things to prevent infection, because there are lots of other airborne infections that the mask prevents. So I think we'll see people continuing to wear masks, and it'll be part of life going forward.
And I got to say, even walking outside in the winter when it's cold, it's a lot more comfortable because it keeps your face warm. If someone has recently recovered from COVID, should they wait before getting vaccinated?
You were breaking up. I didn't hear all the questions.
Sorry, if someone has recently recovered from COVID, should they wait before getting vaccinated?
No, they can go ahead and get vaccinated anytime. The only people that are that it's being requested or recommended that they wait are people that were infected and had the monoclonal antibody infusion. It's just not known if the vaccine would still be efficacious, and if they've had the monoclonal antibodies and they've had infection, that there may not be the urgency to get the vaccine than otherwise. But as far as people that have had COVID or have COVID, they're encouraged to go ahead and get the vaccine.
There's been some reports that people who have already had COVID may only need one dose of the existing vaccines for it to be effective. Do you know anything about this?
I don't. That's certainly not any of the recommendations now. I'm sure it's been being looked at, but the recommendations for people that have had COVID is still the same as far as the 2 doses for Pfizer, Moderna, and one for Johnson & Johnson.
It's also been reported that younger adults are having harsher vaccine side effects than older adults. Why do you think that is?
I think in theory that an explanation for that would be that they have more robust immune system, and so that anytime you inject a foreign substance, you're going to have a kind of stimulation of the immune system, which you want in a vaccine. And the people that have the stronger immune system are going to have a stronger reaction. I think probably the kind of corollary of that is that there were concerns that the vaccine would not be as effective in older people for that reason, because they don't have as robust immune system. But I think that from what I hear of the studies that the vaccine is also effective in older people, but it would kind of make sense that the young people could have a stronger reaction to it.
Are there any high risk groups where getting the vaccine might not be recommended?
I mean, the only people that it's really not recommended is people that have had an anaphylactic reaction to a previous vaccine, and that's a pretty limited group of people. There are definitely groups that it's still being studied. That as far as like pregnant women, it hadn't been studied precisely. Some of the people in the clinical trials, they got the vaccine. They may not have known they were pregnant. It turned out they were pregnant, but the recommendation now, based on the data that's available, is that it's safe in pregnancy. It's safe if a woman is breastfeeding. That it's safe in people that are immunocompromised. Since it's not a live virus, there's no chance of getting an infection from the vaccine. There may be some concerns that since they have a kind of a less strong immune system that it might not be as effective. I think there's people that are going under procedures like bone marrow transplants, whether it might be as to the timing of them getting the vaccine. I think that's being looked at, because if they have a bone marrow transplant and they don't have an immune system, that it might not be as effective. But as far as being contraindicated, there's I'm not aware of any groups that calls for that.
How about on the opposite end of the spectrum, groups where it's essential because of their high risk factors that they should get vaccinated, and we know it's safe? Are there any groups you can think of?
I guess I don't.
What groups shouldn't hesitate at all because they're so high risk? They should get the vaccine.
Well, anybody that's at high risk for certainly for an infection or a respiratory problem, they would potentially benefit more from the vaccine than people that are healthy and don't have any healthcare problems. So, and that's one of the part of the stratification of the vaccine rollout. At first, at least here in Arkansas, it was for people 70 and above, and then the governor dropped it down to 65 and above, and that was due to really limited amounts of vaccine early on. So I mean, there is a stratification process, but the ultimate goal is to have everybody vaccinated, by the summertime.
I have a question from Patsy. If a person has had COVID and still has no smell a couple months later, is there anything they can do to recover their sense of smell?
I don't know. It's like I say, it's a new vaccine, and that's very unusual result of a viral infection. So I think it's one of those things that are certainly going to be looked at closely, but I'm not aware of any any kind of definitive answer as to when that's going to recur. I think it's certainly individual. I certainly know of people that lost their sense of smell, for a few days or a week or so. But there a lot of studies going on what they're called long-termers, people that have a long-term chronic illness or symptoms from the virus, and to determine why it is for them, as opposed to other people that have had the virus. Again, it's a new virus, and it's being studied really extensively, but there's lots of unknowns at this point.
Are there any other serious long-term effects that are being studied?
Well, there's some, they're just real unusual and kind of unique to this virus. Certainly, one of them is the myocarditis that it can cause, especially in younger people. That even with fairly mild symptoms and really no heart-related symptoms, that they still have an infection in their heart muscle. And then there's been some kind of high-profile cases of athletes that had recovered and thought had completely recovered from the infection, but had serious cardiac events because of the undetected myocarditis. Again, I think as time goes on, we'll learn more about that, because that's such an unusual thing with a respiratory virus like this. And I'm sure that all the other long-term symptoms, whether it'd be fatigue, body aches that just continue on for months, as those people are studied more, we'll learn more why they've had such a stronger response to the virus than people normally do.
Can you hear me? Can you hear me okay, Dr. Shelby?
You're breaking up a little bit.
I received a question from Eric, and it made me laugh, but I think there is a good question here about where on the body you can get a vaccine. And his question was, why do you get the shot in the arm and not the butt?
Because it's not necessary. It's not a deep intramuscular injection like some are that has to get deep into the muscle. So that's why it's certainly a lot easier on everybody involved to get it in the arm as opposed to the butt, and so that's the preferred route to get it, because you don't have, in some shots you have to have a longer needle to get deeper into the muscle. This one doesn't. I mean, and so it's just not a necessity that we don't have to worry about.
So last question, kind of in a broader sense, since it's been a year since COVID, what would you say the medical community has learned in the past year that can be reflected on?
Well, I think that one of the big things that I hope comes out of this is that this is not necessarily an isolated event. There are new viruses that come onto the scene all the time, and what we've seen with this is that a new virus comes and it very rapidly becomes a worldwide issue, and I think that health departments all across the world are going to be, I hope, more vigilant and be able to respond quicker if this should occur again. I know even when I was in the legislature, it was always a concern that how little of our healthcare dollars goes in to preventive health and public health. So much of the healthcare dollars goes into taking care of treating diseases, and not enough goes into preventing either preventing the disease or preventing the spread of the disease. So I think that there will be a lot more interest and concern about better funding for our public health institutions, so that we will be able to quicker and better respond for the next bad virus that appears.
Thank you. So we will meet again at some point in April, and we'll continue to meet monthly as long as there's a need to. We'll be announcing the date in April sometime in the next several days, so everyone can be aware of that. And Dr. Shelby, thank you for your time, and I'll give you an opportunity if there's any final words you'd like to say tonight.
Well, I appreciate everybody that participated in this. I appreciate you, Paul, and the Garland County Library for putting this on. I think it's a great service to our community that we can communicate and kind of get information out. I think that's one of the things that's going to be one of the things hopefully we'll do in the future, that we will be able to get public health information out directly and expeditiously, so that we can, everybody can work together to have a healthy, happy community.
All right. Well, thank you, and everyone be safe.
Okay. Thank you.